Not all knee pain is the same, and guessing can only make it worse. So in today's video, I'm going to talk about the 5 most common causes of knee pain so you can tell them apart. Welcome back everyone. My name is Dr. Zach Greenwood here at Performance Sport and Spine in Seattle, Washington. In today's video, we'll be discussing knee arthritis, Patellofemoral pain syndrome, tendonitis, meniscus tears, and IT band syndrome. We'll give you the triggers to be aware of, and by the end of the video, you'll know exactly what you're dealing with, which is the first step to recovery. How this video is going to work is we're going to talk about each topic individually, and at the end of that section, after the test to confirm it, we're going to give you a link in the upper right hand corner to click on for exercises and stretches. So we got your model of your knee. We got your femur or the thigh bone. We got the tibia, which is the bigger bone of the lower leg, and the fibula, which is the smaller bone of the lower leg. And then this is the kneecap or the patella. These blue things are the meniscus, which are shock absorbers, and then these yellow things are tendons and ligaments. First, let's talk about knee arthritis or knee OA. And this is a condition that's caused by damage of the cartilage in the joint. Now, the joint that we're talking about is between the femur or the thigh bone and the tibia. It's this joint right here. Now, your pain is going to be kind of diffuse and it's going to be deep and often on the inside of the knee. With this condition, it's going to get worse with activity and better with rest. If you walk around for a while and your knee hurts, if you take a break or lay down, your pain is going to get better. Also, after you wake up for about 30 minutes, you're going to have some stiffness in that knee, but as you move around, that stiffness will dissipate. As this condition progresses, you might get some warmth around the joint, some bony nodules, some swelling, or sometimes with more severe cases, you actually can get a lack of range of motion in that knee where it won't straighten all the way or bend. Now with this, it's much more common in people over the age of 50. As you age, your joints get a little bit more damaged and wore out. So to confirm this, you're going to look for those symptoms we talked about, that morning stiffness and the deep pain, those clinical symptoms like the bony nodules, the warmth, the lack of range of motion, and then lastly, x-rays, specifically a loss of joint height, subchondral lesions, and osteophytes. If this feels like the knee pain that you're suffering with, here's a link in the video on the upper right to go to our knee arthritis exercise and education and stretch video. The next is called Patellofemoral pain syndrome, which is a fancy name for anterior knee pain. Now here the pain can be a little tricky, but often people describe it as underneath the kneecap, so kind of deep but behind the kneecap, or along the sides of the kneecap. Now the pain can be diffuse, which means it can kind of move around and it doesn't always stick in one place. But if this seems like your presentation, along with the other tests we're going to talk about, there's a good chance you're dealing with this. Now this pain, because it's caused by the kneecap, it's often worse with kneeling, squatting, and going downstairs. This condition is partly caused by overuse. It's also known as runner's knee. So if you're a runner that just started a program and you ramped up too quickly, or just in general your activity level spiked, there's a good chance you're dealing with this. There's also some structural abnormalities in terms of the patella, the position or the tracking of it, or where your tendon inserts into your bone. So these are some things to be aware of, although they're more rare, so really activity is your primary focus. Again, this is going to be worse when loading the knee. So the more you flex your knee or bend down, the worse the pain is going to be. A nice simple test you can do at home is called the J sign. So in a seated position, straighten your knee. Now on the right here, my knee is going straight. My kneecap goes straight. On the left, it kind of has a J motion. If you have pain and you're doing that J motion, it's indicative of this condition. To confirm this, do you have pain with kneeling or squatting? Again, the more you load or flex the knee, it should increase your pain, along with 2 orthopedic tests, the Clark test and the patellar grind test. And both these tests essentially just kind of challenge that kneecap into the bone to see if it reproduces your pain. The more you have of this, the more powerful it is. So if you have all 3, it's much more powerful than just one. Clustering findings is always better. But if this sounds like the pain you're dealing with, here's a link above to click on the exercises and to address it. If you've enjoyed the video so far, but your problem is just a little more tricky than that, you can now work with us online. We're going to provide personalized, tailored treatment plans, help you connect the dots of what's going on, provide reassurance, and then a great way to get you back to the things you love and out of pain. If this is something you're interested in, here's our email. You can email us to schedule an appointment. Next is going to be meniscus tears. If we look at our model, these blue things on the inside are meniscus. And these are cartilage structures that act as joint stabilizers, help with lubrication, and acts as shock absorbers. So they kind of help keep the knee healthy. Now there's one on the inside called the medial, and then one on the outside called the lateral, and they're slightly different shapes. When you have this kind of pain, the pain is very localized to the joint lines, either the inside or the outside. There's different kinds of tears and different positions the tears can be, but in general, we're going to talk about them as just kind of one subject. Now, sometimes with more severe tears, you can have clicking, popping, or mechanical locking, where the knee just kind of gets stuck, or a sense of giving away, where you go to step and your foot just kind of gives out. The catching, locking, or giving away is much more serious than the popping and snapping. That pain is very localized like we talk about and provoked with twisting. So when you challenge that meniscus, it should hurt. Also, if there's really acute trauma, there might be swelling in the first 24 hours, and sometimes it can also be related to the ACL damage or PCL, which are ligaments inside the kneecap that help with stability. So to confirm this, the best thing is an MRI, is showing that the meniscus is teared. But some tests can be that palpation on that joint line. So pressing on those joint lines that we talk about, does that reproduce your pain? The Thessley's test, which is challenging the knee kind of in a standing position, and the Edgy's test, which is basically challenging it on the inside on one position and the outside. Again, the more tests you have positive, the more powerful it is, but if this sounds like the pain that you're dealing with, here's a video in the upper right-hand corner to click on to address it. Next, we're going to talk about patellar tendonitis, also known as jumper's knee, and this can affect the quad tendon above the kneecap or the patella tendon under the kneecap. Now with this, the pain is going to be very localized to the tendon, so it's almost like you could draw a circle on your knee or where your pain is. And it's going to be sharp and stabby with movement and sometimes have a dull achy. Now, 3 cardinal things with tendon pain is as you warm up, the pain is going to get a little better. So say you're doing some squats. The first few reps might hurt, but as you get to those like 10th rep, the pain might diminish a little bit, or maybe by the second set. The second thing is load dependent. What that means is the more weight you lift or the more force you push, the more the pain is going to be. So squatting with 100 pounds is going to be less painful than squatting with 200 pounds. And the third thing is you may pay for it the next day. So sometimes with tendons, you'll do an exercise and you're like, oh, that didn't hurt that much. It must have been safe. But the next morning you wake up and your pain is really bad and you're aching. You've got to make sure that you don't place too much load on the tendon than it can handle, even if it doesn't hurt in the moment. This is caused by mechanical overload. When more load is placed on the tendon than it has the capacity to handle. So it's more about mechanical overload than inflammation. So tendinopathy is probably a better term than tendonitis, especially in the more chronic sense. This can be painful with prolonged sitting, especially long car rides. To confirm this, the 3 best tests are pain with a single leg squat. So doing like a 3-inch partial squat, does that reproduce your pain? Tenderness or pressing on that patellar tendon or quad tendon, and then resisted knee extension. So challenging those muscles that go into the tendon, do those produce your pain? Again, if you have all 3, it's more powerful than 1. If this sounds like the condition and this pain you're suffering from, here's a link in the upper right to click on. Last is IT band syndrome. Now this is the easiest as this is the only one that presents on the outside or lateral aspect of the knee. The pain is often sharp and stabby and it works with activity. Now one thing to note is that this is caused by compression of the band and the bursa, not tightness of your IT band. Your IT band's very purpose is to stabilize your leg and single leg loading, so it needs to be tight. So don't foam roll your IT band for this, you need to fix other issues. And since this is compression, the knee bent between 20 and 30 degrees or flexion often is the most painful position for the knee. Now to confirm this, you need 3 things. A positive Trendelenburg, so standing on one leg, does that reproduce the pain or kind of have your hip tilt down? Secondly, pressing over that IT band and insertion on that tubercle, is that painful? And then lastly is the Noble compression test, which challenges the IT band. If you have all 3, it's more powerful than 1, and if so, then here's a link for the video to address it. That's it for today. Thank you for watching our video on a pragmatic way to understand knee pain. It's quick and concise, but these are the important things to be aware of, and this will separate the clinical relevancy from the noise and help you getting better.